Hi, I'm Danielle Jacobs, and I investigated the influence of fatigue on isometric contraction in forearm muscles. In submaximal contraction, fatigue is shown by an increase in EMG amplitude. This is because of the increased recruitment of motor units in order to maintain force output. This study looked at the influence of fatigue on EMG amplitude in forearm muscles. The hypothesis was that EMG amplitude would increase over time in a fatiguing contraction. 8 subjects were used in this study. During the procedure, 6 electrodes were placed on the forearm flexor and extensor muscles, and the subjects were instructed to maintain 25% of their maximum voluntary contraction for as long as they possibly could, during which time force and peak EMG of the flexor and extensor muscles were recorded. Mean, standard deviation, and slope, as well as percent MVC EMG amplitude, were computed. Flexor and extensor mean percent MVC EMG decreased over time. So results of this study did not support the hypothesis because amplitude did not increase over time in the fatiguing contraction. This could be because EMG was measured between subjects and not within a single subject. One study found sex-related differences whereby women were more fatigue resistant. This study looked at EMG between subjects, and so there could have been influences due to sex. Another study looked at the differences between maximum voluntary contraction and submaximal contraction and found that amplitude increased more in a maximum voluntary contraction. So if this study tested at a higher percent MVC, we may have seen the increase in amplitude that we had hoped for. This study saw differences between flexor and extensor percent MVC, so a novel study could test that difference between percent MVC and fatigue. Muscle fatigue causes a significant decline in the muscle's ability to produce force, and we can see this through an increase in EMG amplitude. Clinicians can use this information to determine the optimal range of resistance for their patients to prevent them from working in a range of fatigue that would decrease their force and would delay their time to recover. So, all in all, we didn't see exactly what we had hoped for. However, we have some novel opportunities to test in the future. Thank you for listening.